Turning to medical news this midday, and 1 in 8 older Americans is living with Alzheimer's disease. Almost twice as many women suffer from it as men, and unfortunately, there's no cure.
But News Channel 5's Roxanne Stein reports now there is a breakthrough that says slowing it down could be as simple as drinking a high-powered prescription energy drink.
As good as others.
You start out and you find yourself lost and you have to ask for help.
The days are not only getting harder for Joyce and Geneva, but for the people who love them the most.
We do our prayers together, and some days she's really on top of things, and some days she struggles to find the pages.
Like 5.5 million other people, Joyce and Geneva are losing their memories, losing their minds to Alzheimer's, a disease that can strike in the prime of life without discrimination.
My Uncle Bob had Alzheimer's. My dad's cousin currently has Alzheimer's.
Neurologist Richard Isaacson watched family members fall victim to it. Now he's using an all-encompassing approach to try and stop it.
I want to do anything and everything that's safe and balanced in evidence.
In addition to medications, therapy, and exercise, Dr. Isaacson is turning to medical foods to help delay memory loss in his patients.
It's not a typical pill. It's not a patch. It's something you have to shake up and drink slowly after a big meal.
Exana is a medical shake, an energy drink for the brain.
It basically gives the brain an alternative fuel source.
Research shows after an Alzheimer patient drinks it, ketone bodies circulate in the brain.
It supplies the brain with energy. It acts like glucose, the ketone body. So it floods the neurons or the brain cells with glucose and gives them a source of energy.
Teresa Alfonso's family started seeing the signs of Alzheimer's in their mother 10 years ago.
We started noticing that she couldn't take care of herself.
Her memory faded fast.
I often tell my mother that she's the little girl I never had.
In January of this year, Teresa was asked by her doctor to draw a clock.
This was her clock. And there was a lot of resistance and she didn't understand.
That's when Teresa started on Exona. 3 months later,
and this was her clock. She did her second try and then she was, concentrating very hard. It's a blessing, really. It's huge progress.
In a double-blind study, Exona was given to 75 Alzheimer's patients. Another 75 took a placebo. After 90 days, all the people taking Exona remained stable or got better. The people on the placebo did not. Experts say Exona works for 45% of Alzheimer's patients.
Grandpa can remember his grandson's name again for a second. If Grandma is more active and alert, going to the symphony or really engaged and talking more, then that's a win-win for the patient and the caregiver and also me.
And although some patients see results immediately, the Alzheimer's Association does not endorse any medical food. It released a statement calling all medical foods, quote, a subject of concern. And some doctors are reluctant to use them due to lack of scientific research. But for Teresa's family, they feel it's working.
I feel like I've gotten my mother back again.
Prescription costs for Exana can vary. According to the website, insurance may reimburse your costs for that shake. Doctors can do a genetic test on patients to see if Exana will help them. For more information, go to WPTV.com, click on Seen on 5. Roxanne Stein, WPTV News Channel 5.